Hey, John Gardner here. It's day 10 of my somatic diet. Uh, and as you recall, one of the big things that motivated me to actually start doing this was um, my knee. So I had some discomfort in my left knee that I'm not sure what it was from. I have a suspicion that it was kind of from maybe from diet. Um, so I've been sort of watching my diet and cultivating a more awareness around how my diet is affecting my physical sensation in my body, in particular around this area that's vulnerable, my knee. So, um, without further ado, I'm going to start actually rehabbing my knee. I'm going to show you kind of how I've been doing it and share a little bit as well about the philosophy of how I'm doing it, right? And this comes down to exposing one's vulnerability from a position of strength, right? So, a quick inventory here about what is uncomfortable in my knee. There's the primary sensation of discomfort is in the outside of the knee. Now it's gotten quite a bit better over the last 10 days or so. But I definitely noticed that this was an area where I felt the most immediate and pressing discomfort, especially if I tilted my knee in or placed load on the knee to the inside, right? So anytime this ligament was getting stretched, I was feeling pretty significant pain, even to the point of just like the way I was sleeping with my legs, in bed. If there was any sort of pressure drawing this ligament into tension, it was creating discomfort. But that's not the only thing. There was also a little bit of pain on the outside, similar, not exactly the same spot, not here, but more here, right? So a little bit more anterior. And there was also the joint itself, right? And here I'm thinking, like, is this a ligament issue? If it's a ligament issue on this side, why is it also twinging on this side? And is it a cartilage issue because I'm feeling it inside the knee itself? So there was a whole bunch of cogitation that I was doing around this, only some of which matters, right? Because at the end of the day, what I'm trying to do is engage this joint in a way that is going to allow me to feel more completely what exactly is going on. So I typically start, as I've done over the last week or so, with a gentle revolving or swirling of my knee, making circles, and these circles are more or less parallel with the ground. So I'm applying a little bit of exterior and interior rotation or adduction or abduction, I guess, tension on the knee, more or less horizontal circles parallel with the ground, and I'm applying very gentle adductive pressure and abductive pressure to the knee. So how am I doing that safely? I'm relying mostly on my back leg here, right? So most of my weight, probably 75 to 80% of my weight is here, and then a certain amount of weight is in my arm, right? And I'm using my other arm to gracefully coach my knee in this shape, through this movement. Now, at some point in this process, once I get used to moving my knee in this way where there is no pain or very little pain, and in fact I'm really not on any edges at all because I'm using my body, the other parts of my body, the other parts of my strength to sustain my weight, I'll begin to press into an edge. Now, it depends on what I'm feeling at the moment, which edge I'm going to press into. Okay, so one of the things that I wanted to also mention was that the probably the biggest mobility limitation that I have been experiencing with this knee is in a full bend of the knee, applying weight to the knee. For example, coming into little thunderbolt, right? The challenge begins. It was happening much sooner, but the big challenge begins about here. I don't know if you can see. Well, you can see this angle on the other leg. If I come down a little deeper, I start to feel this pain here, Yeah, mostly here on the outside and into the joint. Okay, so and of course I want to get that back because I love starting class with little thunderbolt. So I want to be able to fold all the way down without feeling discomfort. So what do I got to do here? I got to again come back to this place where I'm not experiencing any distress, and then start to bring more load to the knee. All right, so now every time I come forward, I'm actually pressing into and dropping weight into the foot. Now, when I first started doing this, anytime I dropped weight in the foot, I would feel it in the joint itself, inside, not the ligaments, but in the joint itself. Now I can do this much more comfortably, and I'm not experiencing distress here. So as I continue to work this, I'm looking for places where I'm coming up against an edge. And so far, this downward load and the forward load, as far as I've gone, right, you can see that I haven't really gone much further, barely even to vertical. It's not causing me distress. If I press it into the inside, that's pretty good actually today. So, but this is what I have been doing, right? And as the discomfort arises, I back off. So I make sure that I have enough strength to back away from any condition that might cause me distress. So here I have my arms to support me to back away. Here I have my back leg to support me to back away. Now, when I start to stand up and press more confidently in, right, I'm pressing more confidently in because I know I've already done the work to feel like, oh, this is sustainable. I'm strong here. So I know now that I'm strong at least right here with my knee essentially vertical. Now, if I start to what I'm going to do now is I'm going to take some of my weight into my back foot, and I'm pressing down into my front foot and stretching my legs, stretching the mat, so that I'm feeling some forward pressure in the knee. And now I'm going to, remember that, how we make circles with our hips during class? We can do this with the knee too now. As I do this, right, because now I've got I've got a big chunk more weight on my knee. I feel, as I come back, I come in and back, I feel a little twinge here, right? So I'm going to palpate this a little bit, feel into it. Make sure this is part of the focusing very specifically on a very, very particular part of the body, right? Understanding what the very specific spot is that feels sore. So it feels a little bit like in here. Now, I don't know what this is, and I don't know why this is the part that's feeling sore. I just know that it's feeling sore. So as I approach applying load, I'm going to pay attention to when that thing lights up. And a lot of times just palpating something, pressing on it, pressing into it, helping it to soften, can relieve that pain. And in this case, it seems to have pretty much alleviated it. So you can see I'm more confident in the bigger motion here. As I bring my knee to the inside, it feels safe. Now, what I want to make sure is that I don't lose my balance and then have to really drive hard into this leg to support myself. If I were to do that, I could undo all the restoration work that I've gone through the last 10 days. So I want to make sure that in no circumstance am I going to re-traumatize this part of my knee, because this is where it was most tender. All right, so if I want to start pressing a little further in, take a little bit more of a risk to press into the inside, which is where it had been causing me distress, I'm going to bring my arm out and really support myself. Now I can still press in here. I can still add a bunch of load to the knee. And so far, so good. All right, now I'm going to take my leg out so I can press even harder. Now you can imagine, you can see I'm driving weight down into this foot, through the shin, through the knee, from an internal, from a less than vertical angle here, right? So I'm pressing down in here, and I'm feeling, and it's feeling solid. So now I'm going to make circles here, so that I know that I have full range of motion from this posture, and that this feels okay. And I have to go in both directions because you don't know what you're going to discover in the other direction. Now I can tell you one thing. that I feel very vulnerable here. Now remember, when in class we talk about the different kinds of edges. Vulnerability is an edge. So as I come through here, I'm paying attention to my body's hesitance to proceed. And I'm only going into that zone after I slow down, register in my conscious awareness that the vulnerability exists, and then proceeding through the range of motion where that vulnerability comes up for me. And so far, it's feeling okay. Now, I'm going to introduce a concept here called sensata non grata. Now, you may have heard the term persona non grata. That's a person who is unwelcome. Well, sensata non grata is just a feeling that's unwelcome, right? And when we're approaching a vulnerable spot, there's this association to a sensation. Usually, at least it's been in my experience, there's an association to a sensation that we don't want to feel. There's an association to sensata non grata. It's coming up for me, this feeling of, oh my gosh, this could be bad, right? Well, what makes me think it could be bad? Typically, it's a somatic memory or a genetic memory of something that you're not supposed to do, especially in the case where I'm not actually feeling it yet. I'm not feeling pain there. I just feel vulnerable. So I'm shying away from it because I don't want to feel whatever it is that's hiding behind that door, right? So better, my subconscious, my instinct is to stay away from it rather than to move into it. But my conscious awareness says, in order for me to understand it, I have to proceed. So I proceed into the terrain from a position of strength. So I know I'm going into a vulnerable space, but I'm going in from a position of strength. Now, I have to say that I expected to have to do more work. So my knee apparently is doing better today than anticipated, which is cool. Right? I'm happy about that. It's interesting is that now the twinge on the inner ligament happens almost now when I'm pushing a little bit, when I'm making an effort to push out, I feel a twinge here. So this is a mystery. How is this? I don't know. Maybe a physical therapist can tell you, and I'm not a physical therapist, so I'm not qualified to comment on all the anatomy and how it all reacts. But I can tell you that this feels like I'm feeling a little twinge here, but it's not the kind of pain, right? Two kinds of pain: pain where healing is occurring, pain where healing is not occurring. This is the good kind of pain, so I'm not afraid to proceed in here. I want to explore it. It's a signal. It's information. My body's telling me something here. I don't have to understand everything about it. I just need to pay attention and work through that movement. And again, palpating often helps remove something. Might be stuck toxins. Who knows, right? Could be anything. Blocked energy. And that's feeling good now too. Okay, so we have one last piece. Well, there was a point here in my assessment of the nature of this pain where I thought maybe it was because I hyperextended my knee. Because when I straighten my leg, I feel pain in this ligament here, the underside. And I also feel that sense of vulnerability in the joint as I straighten my leg. So I'm like, oh my gosh, I don't really want to really fully lock out my knee because I'm afraid it's going to hurt. It feels vulnerable. That same kind of vulnerability sensation that existed in when I was trying to do that interior rotation. So, and I want to get to my little thunderbolt. I want to get back to the place where I can comfortably, fully draw my heel to my knee or to my glute and not have any pain. Now, here's what's happening. Okay, so here I am, sitting here. I want to be able to do this and bear load on my shin, okay, with this leg. So far, so good, right? As I'm using my arms to manage this. Now, what I'm doing now is making sure that there's no sort of sympathetic cramping or disconnection or ache in my hip flexor, and I'm letting my shin be loose, right? So the gravity is working my knee right now, and so far with gravity working my knee, it feels okay to here. Now I got my hand in here, so it's preventing a full expression of this knee bend. So now I'm going to take my hands to my feet, to the bottom of my foot, and in front of my shin, and I'm going to start to draw it in. Again, no load on the muscles in the joint. I'm doing this. I'm using other parts of my body that are strong, that I can very clearly turn off or retract, right? I'm using my arms to move my knee in until I get to the point of discomfort. This is approaching my vulnerability from a position of strength. It's very clear that I have control with my arms that are very strong and not injured at all of the bend in my knee. The angle of my knee is controlled by my arms. Now, I get to about here. Let me see if I can share this with you this way a little bit. I can get to here. Now, that's not, this is where the pain starts to arise. Now, if I draw it in more, okay, there's like a threshold. I bring the knee into here, I start to feel the pain. I bring the knee in further. There's another point where pain begins to rise. If I bring it in further, it feels like there are two areas, and they ultimately merge. Now, I don't know what this is going to feel like with weight on it, because I'm actually not applying any weight here. I'm compressing with my arms, right? So it'd be a different load. Gravity will be doing something very different when I bring my knee under my torso. Okay, so what I'm doing here now, so I've understood now the linear expression of my body, the pain that my body is going to express when I draw this in a linear fashion. So now I'm going to go back out. Aha, see, did you see that? Okay, I don't know if you saw me flinch. When I turn my ankle out, there's a small amount of rotation in the knee. We think of the knee as a hinge joint, but it's a modified hinge joint. It actually does rotate out a little bit. And when I turn my ankle out to express that external rotation of my knee, I felt a little twinge of pain, and I very quickly flinched because it felt very vulnerable. And that's the activation of that in that same spot where I had been experiencing most of the discomfort before. So I know there's still some trauma here that needs to be healed. What can I do about that? For the moment, I'm going to compress and massage. Right? Why that? Well, because I can actually trigger the discomfort by doing that. Right? And it's a very safe and soft and controllable expression of my conscious will into my vulnerability, right? So I'm not blindly pounding on my knee. I'm actually essentially loving my knee by massaging it with my hands, and I'm making sure that this very spot where I feel this tenderness, it's really, it feels like a bruise in the connective tissue, and there's a little click under here. I don't know what that could be. Hopefully it's not something terrible, right? Like, I mean, I'm always freaking out that I tear some cartilage loose or something. It doesn't feel, I don't think so. I think it's just, I don't know what it is. But I think it's healing, so I'm confident. I feel good. Okay, so now I've reawakened my sense of the domain of this discomfort, this tenderness. I can feel around in here as I press into different parts of my knee, and I think this is actually is useful to share close up. As I press into different parts of my knee, like I can feel like right through here, as I palpate it, as I press, and I both do and don't want to press on here, right? Because it's tender. Ow, ow, ow. All right, that's that little ridge, that little click. I'm rolling over some piece of fascia or connective tissue, and it hurts. But I also recognize that if I do this gently enough, I'm likely to bring healing to it. And that healing, I don't really, I mean, I can speculate, right? Based on my philosophy, I can say that it's partly it's bringing lymph fluid, it's massaging the tissues to remove the toxins, the ama, whatever's been built up as a consequence of the injury. I could say that it's love. I can say that it's prana. I don't know what it is. It doesn't really matter to me, right? What matters is that I feel like I'm doing the right thing for my body. And as I do it, my body seems to respond positively. It's not as tender, right? So it's feeling better, and I can apply more pressure. By the way, I learned a bunch of this, both philosophical and practical technique from an acupressure doctor that I went to who used to cause me all kinds of pain. Mostly the good kind, but there was a lot of it in every session. Dr. Lin, I don't know if he's still practicing. He was in Union City. Very interesting guy. Also sang opera. Okay, so having given this a good massage, let's go back to the folding. Let's see if we can get some folding with some other range of motion involved. Right, so I'm gonna. Okay, now that I know that's there, I'm tweaking the ankle out very mindfully, very carefully, and guess what? It actually doesn't. I mean, it's vulnerable, feels vulnerable, but it doesn't hurt. Right, so something that I just did, something in that process, has released pain. Now, if I push harder and carelessly, that pain will come back. I can tell. Right, so I don't want to do that. I want to do this from a position of strength. Now, what am I going to do here? I know that there's weakness. I know that there's weakness in this rotation, this desire to rotate my knee outwards. So I'm going to rotate it out without causing it stress, and then I'm going to apply load to try to bring it back in. So I'm essentially doing the reverse of the twist using my muscle energy. So I'm trying to draw my knee in against the twist out. That's going to, like when I say healthy stress on the outside of the ankle or the outside of the knee, this is an example of using it therapeutically. I'm pushing myself into vulnerability passively. I can feel the vulnerable, scary thing. And now I'm going to apply muscle energy to bring it back away from the vulnerable space, build strength and awareness around that edge, right? So, and that seems to be working. Okay, so let's see what else we got. Okay, so all right, now I just pulled in too hard and that hurt and it scared me, right? So now I have to work this part. This is probably where the rest of the healing work is going to happen, either in this deep fold or the full extension. Feeling into what's vulnerable here. This deep fold feels pretty vulnerable. I don't think it's ready to bear weight. Oh, something just popped. Huh, something just popped in my knee. Did you? I wonder if you heard that. Okay, so now as I hug it in, I'm here now with no discomfort. Little tiny bit of wake up call right here. But then as I bring it in further, it feels, well, there's a little bit more out here. But there's something going on inside the joint. So, and it's really hard to describe. Now, okay, now at this point, if I do that same thing and turn the ankle out a little bit, with this much of an interior of an angle in my knee, it's scary. It hurts, right? There's a little pain there. I don't know if you can see it on either one of these cameras. My leg's in the way. This. Okay, so. And you notice how much load this arm is taking, right? I am not doing this all by myself. My leg is not doing it all by itself. I'm using my arms to support and protect. any kind of wayward movement that might happen in my leg, in my knee. And I'm pressing into this vulnerability with the knee bent more. I'm pressing into it, more pressing into it. It's almost like this is the injury, right? I feel like, look, I'm really close in here now, and having exercised safely into the vulnerability, I'm now feeling like I can really fold this in, because now I'm really hugging it in, right? And so what made it go away? What made this joint discomfort go away was when I applied the twist to my knee from a position of strength and control. I slowly went into my vulnerability, and it's still there, right? If I push too hard at this kind of angle, if I push too hard on my foot to turn it out, okay, if I really hold my knee in, and you can see this is a pretty tight in, and I push my ankle out, it's scary, and there's a little activation of discomfort. There's a little activation of discomfort in the knee. But in so doing, I've actually been able to bring my knee in further. So there's something about approaching my vulnerability with this mindful care, not giving in to the fear of sensata non grata. It's stuff that sure, I don't want to feel it because it's scary, but it's in the feeling of it in a controlled mechanism, in controlled conditions, that actually helps my body activate the healing, release the bracing, and bring vitality back into the joint. Right now, like I say, I'm not a physical therapist. There's a bunch of stuff I don't know. And if you want really expert advice, on the physiology of this, you probably should contact a physical therapist and talk to a physical therapist. This is my disclaimer, right? I'm trying not to make any medical claims here. I'm only telling you what's going on in my body, right? Now, okay, so now extending the leg under my own power. My hip flexor is a little crampy, so I'm just going to turn so I can unload my hip flexor a little bit. And I'm getting more into a full extension. I'm pointing my toes towards my nose, so that's activating even more of these ligaments on the back of the leg, behind the knee, and I feel them, and they feel tender, so I'll probably massage them. And I'm drawing my knee in under my own power now. Now, what I'm not doing is exercising, okay? That's not what this is about. I'm not exercising my knee or my thigh or my quads. I'm moving my body through the range of motion in which I have felt discomfort and assessing what part of it I still feel. And I still feel a little bit on the inside of my knee, right as I extend through this range of motion, just from here to here, and I feel it in the back of my leg, in extension. Now, when I fold it in, I still feel it vulnerable and a little bit of pain, and it feels like it wants a kind of movement that is more circular than just flexing. So again, it comes back to this movement of the ankle and the hip, trying to create some kind of more complete expression of the range of motion that's in my knee at this angle. Okay, so we're almost, it's almost enough for now. I could do more, and I probably will after I get off camera. But I want to do a little test. okay, of the nature of the progress that I've made so far. Now, here's where the ego can get us into trouble. I'm going to kneel, and I'm going to try to come down into the little thunderbolt. I really want to be able to get down there, right? It's important to me for my teaching and for my sense of wholeness in my body. I want to be able to get back there. I know that I can't. But I want to see if I've made progress. Now, I don't have to do that. And I don't recommend that you do it very often, because it's not really about measuring your progress. It's about how good you feel. But I'm going to do it because I would just want to see. Because that's the kind of guy I am. I don't know. It's kind of... and maybe just to share with you as well. Okay, so... All right, I'm on my knees. I'm pressing weight down into the knee. Now, what's happening here is the joint, right? We got this joint, and when we bend the knee, right, there's a different alignment of the bone. So now the weight is dropping down, and it's my ligaments that are preventing my thigh bone from just dropping past my shin bone into the mat. So whatever it is that's hurt down there is now under some load, and that load becomes the nature of the load changes as I bring my hips back and start to fold into my knees. Now, first thing I'm going to do is get my 3 long fingers down so that I can slowly lower my way in here without creating trauma, and that I can bail. I can very easily get out. I can just throw myself forward with my arms. Now, before I bend further, I'm going to take the load into the knees, right? So there's 2 things that we can do here. I can suspend myself and bend further without adding load, or I can keep myself where I am and add load. Right? So now I feel pretty good about my range of motion, so now I want to be in this practice of adding load. I feel strong. I feel like I can get out. Okay, I'm starting to feel vulnerable in the knee. So I'm going to place my fingers down so that I can determine just how much. The other thing that's happening is this is a stone stone patio. So my knees are, the surface of my knees is getting a little tender. Okay, so here I am under load at this angle. I feel vulnerable. Now, I'm going to very gracefully, very gently press down into my back leg, into my lower leg, to press myself up. This is an exercise in determining the nature of the strength that I have in this range of motion. So you notice I just curled this foot under on this side. So my toes are, now I can lean in here and take load off. So here again, right, I'm approaching this vulnerability from a position of strength. All I have to do is lean, right, and I'm safe. I can take load off, and I can take load off very gradually. I can feather control how much load I take off of this knee. And I can put it back on in a very, very controlled manner, just by swaying left and right, because I have this propping me up now. So I'm not using my hands, but I am loading this leg. So this leg is not taking 50% of the load. It's taking more like 25, between 20 and 30%, I would say. Because I'm in the vulnerable space. Now, if I come back up here, I can drop it in 50-50. But as I come back down, I'm noticing, as I try to keep my hips square, try to draw the weight down evenly into my knees, into my lower legs. Even, no pain. Feels scary, but it's not, there's no pain. Okay, now, because if I go any further, I won't be in a position of strength without some additional support. I'm going to bring my hands down and then continue to press into my lower leg. Okay, that's about it for today. That's as far as I can go. So I'm not loading, I'm evenly loaded, but I'm not all the way down. You can see that there's quite a bit of space here. And I want to be able to get all the way down. Now what I'm going to do is take the load off, use my arms to support me, relax my thighs, lower myself in, slowly, noticing when the resistance arises. There's a little sense of inflammation, maybe like swollenness in my knee here. Not a lot. Here's a little bit of pain. Just the first edge of pain is right here. But it's not really getting worse. Look at that. Okay. I'm now supporting probably, I don't know. I don't know. There's still discomfort in my knee, and I don't think it's wise for me to stay here. I think it's wise for me to come out. And as I get to the edge of the discomfort, I'm going to reapply energy into this lower leg to press down and feel that strength again. Because I want to feel strong. I want to leave this practice feeling strong. Notice I've curled that under so that I can balance and feather the load. Yeah. Okay, so I'm going to come out now. And I'm going to straighten the leg. Oh, there's some, yeah. So one could easily say that I just overdid it, right? In the desire to explore and understand what's been happening in my leg, I may have unwound some of the therapy that I've just done, but it's not a lot. And if I'm wise about how I apply my energy, my chi, my compassion, self-compassion, is probably going to be fine. And I think I made a lot of progress. So there's an example of using, approaching one's vulnerability from a position of strength, feeling into your vulnerability, working your edges as a therapeutic construct in rehabbing my knee. So I hope that was interesting for you. If you have questions or comments, please, I'd love to hear. I'm John Gardner with BeVital Yoga. Find me at bevital.life and on Facebook at facebook.com/bevitallife. Thanks for joining me.